All right, everyone. I just got the thumbs up from Jan, so here's hoping that you can see and hear me. I now understand what Chip was referring to in the past sessions yesterday during the kickoff and his COVID session, that this is understandably awkward. I think we would all rather it be balmy July and in a ballroom together and being able to interact. But in the meantime, we are taking advantage of all the software available to us and making this happen now. So my session today is on the patient portal use, especially through the lens of the age of COVID-19 pandemic that we are all in now. My name is Kate Taylor. I am a client advocate at PCC for the Green Team and recently stepped into the role as the account team coordinator as well. I'm also a mama, so this subject matter is very near and dear to my heart. I am an avid patient portal user, and I was actually before I started at PCC. I didn't quite make the connection until I think my second interview that tool I had been using on my iPhone called My Kids Chart had the word or the letters PCC in the URL, and it all came together. So you may remember me if you were part of the family and here at the 2019 Users Conference. I did the What's New General Session morning presentation with my colleague Sarah Gleish. If you don't know me, nice to meet you. All right. So another plug for the UC 2020 chat channel. Probably the biggest part of the UC that I'm missing is the social networking, the getting together, the being able to meet with people face to face. I really miss that. And so I have taken it upon myself to be active and present in the chat because I want all my clients to know, all Green clients to know, really any member of the PCC family that I'm here to discuss things with. So I encourage you, if you are not already on the chat, to access these slides later, use the join here link. I believe PCC Marketing also sent a join now button in an email yesterday. And I do recommend that you use your full name and information, which practice you're with, perhaps your role. That would be helpful for other users. If you are aware of your PCC acronym, you can end your username in _ acronym. Like myself, I am Kate Taylor _ PCC. It really is for my own sanity. It makes it very easy for me to find my own clients. So if you could do that step, that'd be great. We also have a lot of Melissas and Dianes. I don't know why. It's really fun trying to tell jokes and no one laughing. But Jan's smiling, so I must be doing okay. I'm also here to give you a break from having to look at Chip Hart all the time. All right. So today's session goals. It turns out that about 87% of PCC active live clients use the patient portal today. So all things being equal, if there are about 100 of you watching this, that means 13 of you do not know what the patient portal is. So I want everyone to leave with an understanding of why this tool is so important to both your practice and your patients, their families, and their community. I want to discuss how the patient portal fits into your everyday workflows. And I hope that you gain some ideas, those who do have the portal enabled, how to optimize that use in this time, not only to keep you financially viable, but also for your own health and the health and safety of your patients and your families. Everyone is staying at home. Hopefully they have an internet connection, and that means they can gain access to the portal 24/7 on a desktop, laptop, iPhone, Android, you name it. I'd also like to make the connection very clear with you all of how the patient portal use fits into billable telemedicine encounters. So really before this all hit us in March, I think that all you lovely pediatricians were doing an awful lot of work for free. And it turns out that there are billable exchanges on the patient portal, and I want to make sure you all take advantage of those opportunities. So what is the patient portal? It is a secure means for folks to be in touch with you. It also is 24/7 access to a lot of their very important medical information on demand. It is a tool for your patients and your families, patients who are of age of consent, and their family members to contact you securely. Because this is not just, happytimepediatrics@gmail.com. This is actually a secure portal in which you can have a HIPAA compliant PHI exchange, including messages, pictures, even videos. And it, again, is a tool, a very important tool to keep everyone safe and in communication during these times of social distancing and many states that still have stay-at-home orders or have extended their stay-at-home orders. Of the 87-ish% of the PCC clients who are currently using the patient portal, only 50% have payments enabled through the patient portal. So we'll be touching on that as well. You can get paid through the patient portal, very important. So as I was saying before I joined the PCC family as an employee, I didn't realize I was part of the community at my pediatrician, formerly known as Hagen, Reinhardt, and Connolly, now Lakeside Pediatrics. One time I was on vacation in Biddeford Pool, Maine, and my little toddler got a mosquito bite on his face, and then he fell asleep in his pack and play on his face, and he woke up looking like Quasimodo, and it started turning purple, and he couldn't see out that eye, and I was completely panicking. It was a Saturday or a Sunday. I didn't want to bring him to a pediatrician we didn't know and leave the sunny beach. We were icing it, we were panicking, he was our precious firstborn. So I fired up my patient portal and took many, probably too many photos of my son's face and was able to send them securely and immediately to Lakeside Pediatrics, and their nurses and even my primary care physician were able to weigh in and quickly calm my fears, letting us know that it's just a delicate part of his face, give him some Benadryl and he'll be fine. It took a few days to calm down. There are definitely some interesting family photos from that period, but that's just one example of a billable patient portal encounter that kept our vacation happy and sane and happened across state lines all over a weekend. So crisis averted. It was just a mosquito bite, but that's just one example of how valuable and easy this tool is to use for parents. All right, so you might be asking yourself, if you're one of those folks who do not have the patient portal, how do I enable it? It's super easy. You just ask us. We turn it on. I do feel, in my experience as a client advocate, even in rapid response, that there is some trepidation or fear in turning on another tool. There's some misconception that this means people will start texting doctors directly. That's not what this is. If anything, it may seem in the beginning, just getting used to a new tool, that you're going to have more work on your plate. I feel strongly that the patient portal enables you to have less work on your plate. It's less unnecessary phone calls, it's less unnecessary sick visits, it's less frustrated or scared parents waiting on the phone lines for a nurse triage, it's less voicemails piling up in your inbox. And since it's seamlessly integrated with the EHR that you're already in all the time, it really is quite easy to manage. And once you enable it, the control is in your hands as to how you communicate this to your patient families and your community. Just because it's on doesn't mean you're suddenly going to be flooded with communications. You can turn it on and take your time strategizing how best you want to communicate to your families that this tool is available. Some folks charge for patient portal administration. You can choose to do that. Some folks have the patient portal on, but do not turn on messaging. So then families still have the ability to, say, grab their immunizations records, look at growth charts, look at visit notes from prior visits, see upcoming appointments, et cetera, documents, all that, but do not have the means to message you directly if you do not feel that your staff is ready for that. Perhaps you have folks furloughed or difficulty connecting remotely right now. We don't want to make more work for you. We want this tool to fit into your workflow seamlessly and help you with your day-to-day work, not make it more difficult. All right, so the patient portal, using it, 101. You may have noticed across the top of your EHR that there is a tab after ERX called messaging. That is where your interactions with the patient portal will live. It's already something you're familiar with. There will just be a new task type called patient portal. Again, super important to note, I'll keep hammering this home. Many of these messages are not only perhaps an intake to become a billable telemedicine visit, they themselves can be a billable telemedicine visit. So keep that in mind. And for the physicians and providers and other medical decision makers watching, you can also receive and respond to your patient portal messages right from Pocket PCC. So you do not have to be sitting in front of your laptop or desktop. You can just glance at your iPhone, see that you have a new portal message, perhaps assigned to you by your staff because you need to address it, and easily respond to it right on your phone. All right, so it's the best of times, it's the worst of times. In some ways, we are more busy than we have ever been. I think the week starting Monday, March 16th was the craziest week of my life. Many of us have been thrown into figuring out this new normal, this new life balance of being at home with your entire family 24/7, trying to work, managing your children, childcare is closed, you name it, and you all are in that same boat. And an unfortunate side effect of this pandemic was a pretty significant drop in visits. We do see that picking back up, but what that does mean is that some of your staff might have more time on their hands to optimize the tools you've always had at your fingertips, including the patient portal. There are means to use the patient portal to easily do intake for numerous types of visits, whether that's a med check, behavioral health. What if you know of a family who's lost a member to COVID-19 and you want to reach out to them? Are they struggling with depression? How are they dealing with grieving? Are there first-time mothers at home with newborns who are unable to see a lactation consultant in these times? Reach out to them via the portal. She's probably up at 3 a.m. nursing with her iPhone in her hand anyway. You now have made yourself available for her to say, I'm panicking, he's not latching, or I need help with sleep training, or how do I deal with disciplining, or screen time, or potty training, or picky eating? The list goes on and on and on of parental concerns right now that can all start as a patient portal exchange. And what's great about that is that it's all at home, where they already are, where you already are. Everything's happening safely and contactless via the portal. And now that we have the new broadcast messaging tool, which is free through August, you can use that tool in conjunction with the patient portal, using this more free time your staff may have on their hands to encourage patient portal signups. I highly encourage incentivizing your staff. If you're worried they don't have a lot on their plate right now, you can take this time to say, all right, we're doing a sprint of patient portal signups. Whoever signs up the most folks in the next week gets an Uber Eats gift card, whatever it may be. Just use the tools at hand that are free to encourage folks to sign up for the patient portal. And coming very soon in the June release, folks won't even necessarily have to have an email address to sign up for the portal. They only need a cell phone number. And then you, as the practice, will be able to track what their preferred patient portal communication method is, whether that is an email alert or a text alert. I know a lot of you have been very anxious for a means to text folks. And this is one of those ways, in addition to the broadcast messaging tool. And then my personal favorite, I am on the green team after all, and a hippie Vermonter. I like that the patient portal can help us save trees and go paperless. There is quite an abundance of documentation in the pediatric world, whether that's patient education handouts, handouts you've designed yourself, asthma action plans, you name it, it's innumerable. School forms, camp forms, immunization forms, etc. The documents that currently live in your EHR, once the patient portal is enabled, can be marked as available in the patient portal so that folks can access them on demand. You can strategize how you want to use the patient portal messaging template tools to create a more streamlined workflow for folks to request, respond to, and receive frequently asked for forms, such as camp forms and school forms. So that takes an awful lot of walk-ins off your plate, those frantic phone calls, people trying at the end of a sick visit to say, oh, we need all these forms. Let that all live in the patient portal and be a more efficient exchange with less paper. Also, when creating a patient portal message from within your EHR, you are able to attach any document to that easily. So again, mom of Timmy comes in, she's concerned he was exposed to COVID-19, you ruled that out, they get home, she says, oh my gosh, I forgot to get a visit summary. You can generate one and attach it to a portal message to her, or you can say, hey, just so you know, this is already available to you in your patient portal, and let her know where it lives. So in researching for this presentation, I was very surprised to hear that only 50% of our patient portal users in the PCC community have payments enabled. I love making payments through the patient portal. That's one less phone call or email or exchange with the office that I have to have. I can simply log in, view my outstanding balance, and pay it all right on my iPhone or on my computer. And we also have the ability for folks to save multiple cards. So there may be balances that are HSA applicable. There may be balances that are personal. They can save those cards and easily pay both balances right from within the portal. So that takes another step off your plate of hunting down money, especially in these times where it is more crucial than ever to cut down on your AR days. Now you have another tool to get those personal balances collected as soon as possible. And gosh, I breezed right through this. I talk too fast, I apologize. And like Chip was saying, when there isn't the folks right in front of you or the questions popping up on the fly, so there are some very important related courses already on the docket for our virtual users conference. One of them is coding and billing during COVID-19. I'm certain you will have thousands of questions on how to properly code a patient portal exchange or when the context is appropriate to bill for a patient portal exchange. So certainly be sure to attend that tomorrow. It's from 1 to 2 p.m. Eastern Standard with our own Jan Blanchard tomorrow. There are also courses coming up on how to optimize other PCC EHR tools. Again, with some more time on your plate, you may realize or identify these are the pain points we've been having with our various workflows, whether it's lab orders or tasks or patient check-in, whatever it may be. Identify those, come to that course, and bring your questions about how to use the tools that you already have in the best way possible to make things more efficient for you and your practice. There's also the June COVID release coming that has numerous patient portal features and enhancements coming down very soon. And I want you all to understand the implications of these and be prepared ahead of time to put those into practice. That is on May 27th and May 29th. And there's also a recall strategies coming up on the 27th. And I feel that patient portal fits into that recall toolkit at your fingertips. So be sure to attend that as well. There will be, I believe, and Jan can correct me if I'm wrong, a roadmap course as well. It hasn't been scheduled yet, but that's very exciting to see what's perhaps not coming in June, but what PCC is hard at work on developing, whether that's checking in via the patient portal, so folks can drive up to your practice, check in contact lists. Perhaps they're following up on a telemedicine audiovisual well visit and they are there to get their vaccinations. That could all be done during the portal. As you all know and are excited about, we're working very closely with Chattis. That will certainly marry very closely to the patient portal. So once the roadmap course is scheduled, be sure to attend. I also have an awful lot of resources. This is my plug for learn.pcc.com, my favorite website. Lots and lots and lots of resources, because I know I threw a lot at you about the why you should use the patient portal, but not the how do we use the patient portal. So I'm sure Jan will be distributing access to these slides in PDF format. They'll be available for you. Please take advantage of all these links. I tried to put them in a logical order. So please take advantage of everything that learn.pcc.com has to offer. And with that, I believe we are ready for questions and answers.
Awesome. Thank you so much, Kate. The question and answer activity on the live session has not been super huge, but what is coming up is some folks talking with each other about things like consent. So the idea that patients and their families are required, in some states they are required to explicitly consent to that, to telemedicine, to telehealth care. And that is sort of on a state-by-state, carrier-by-carrier basis, which I'm afraid is the answer to a lot of these questions. I feel like a broken record saying, check with your carriers, check with your state. But there really is no one-size-fits-all. Like Chip was saying yesterday, we have seen every possible permutation of requirements for billing, for consent, for which modes of telemedicine are allowed, but specifically portal. There are absolutely codes for those, and we'll go through those in the session tomorrow, like you said. Another question that comes up for me, if you don't mind me sharing some of the things that clients are asking me about.
I'm looking at it myself as well, actually. So.
Oh, good.
Yeah.
I got a question just this morning via the UC chat. Someone reached out directly to me to say, so my patients are not so psyched about the idea of being billed for these services that they were receiving for free before. So the bit that I was able to share, you guys all, your peers here are your best source for the things that are working for patients. I don't have any patients. I don't have a medical degree. But the solution, or the suggestion that I wanted to share from the conversation this morning is, if you haven't considered it, many of your carrier contracts require that you bill for this service. So they've been saying all along that everything can be billed, should be billed. So you sort of, the gentleman's agreement that is CPT in the US, if there's a code for it, it is intended to be used to report services that you are rendering to patients. And carrier contracts use that standard. They agree to use that standard. So it's a tacit expectation that you will bill for everything that you render. So if you think about it, that's all that you can render right now. In some cases, you do not have access to lay hands, and you want to maintain that connection. You have to maintain that connection with your patients and preserve that sense of safety that they find in being a part of your practice. So letting patients know that their carriers are requiring you kind of can't get around it anymore. You might have been able to be the nice guy, as pediatricians are. You might have been able to be generous with that time. You can no longer afford that, because the implication is that if you're not doing telemedicine right now, if you're not billing telemedicine, they may not believe, or you may not have proof to their liking that you're rendering telemedicine, telehealth. If you're not billing for it, they think you're not doing it. And if you're not doing it, you're not necessarily meeting their clinical minimum standards. So you've got to protect yourself as well. So that perspective is one that isn't necessarily shared by a lot of patients. They're not aware of that. So if they're unaware of that, that's something that you might offer, in that you kind of can't pretend you're not doing it because that's all you can do right now. So your hand has sort of been forced by this extraordinary circumstance. But we do have a question that came through. It appears to be for other practices, but it's a consideration nonetheless. Consideration, and it's one of the considerations I think that you had brought up, Kate, is coming up with that plan for, are you monitoring portal messages on the weekend? Who's responsible for that? During the times that you're closed, assuming everybody is going to take care of portal messages, assuming everybody is watching, is akin to assuming nobody's watching. So the advice that Kate had given just a little while earlier looks like it's drummed up some conversation in the UC Live session chat, which is exciting.
I appreciate Dr. Sachs just chimed in with, there is a configurable secure message disclaimer that lives within each EHR that you can customize to your needs. He added to his, please include up to 2 business days for a reply. Going back to the question from Jessica at PTP, I would say whoever is on call, consider these weekend patient portal messages just like folks who hit 1 to speak with someone now, and many of them you can glance at and say, oh, this is really billing. This is more housekeeping related, and easily right from the portal message, create a task for the appropriate queue or team member at your practice. But I would consider it like being on call. So whoever is responsible for that on the weekends could add checking the messaging queue, periodically. It's just like the nurse's voicemail box. And they might not all be urgent. They might not all need to be addressed right away, but there could be some that do. So I would handle it like you would a voicemail box, and disclaimers will help you there. Going back to the discussion you were just having, Jan, about how do we set the precedent for our families that in this time there are going to be services that were billed that perhaps they had become accustomed to receiving for free. I have received many thoughtful letters from my dermatologist, the hospital, my dentist, my therapist, my primary care provider. They're all putting it all out there, charging for personal protective equipment, new hours, staffing issues, who is allowed in, when are you allowed in? Is there a well visit waiting room? Is there a sick day? Is there a well location versus a sick location? Are there additional charges? Are they offering telemedicine? These are all ways you should be using the broadcast messaging tool to send thoughtful letters out to the families, laying it all out. And if they do have questions or concerns or are upset with something that a payer has dropped personal, a thoughtful phone call. If my primary care or the office manager of my pediatrician reached out to me to explain things, it would mean the world to me. And once they let me know, the exchange we had about your son's rash all over his body that we addressed over the portal, that was a physician zooming in on those photos, using their knowledge and recommending care and following up with you. That was a telemedicine sick visit, and it should be billed.
Agreed.
Yep.
Yeah, the amount of care that's been given away in the past by pediatricians far exceeds other specialties. I appreciate your point about all the other professionals in your life that are billing for their time. For them, this is de rigueur. So it's unfortunate that it's a change. It's a change among many other changes right now. But it is also, I've banged this drum for years, that your patients aren't going to value your time until you do. And your time is especially valuable right now. The reassurance that your patients get from knowing that you're thinking about them, that you're reaching out to them. We've seen a handful of clients mount some really passionate campaigns to their patients to reinforce the amount of heart and soul that goes into the time they spend thinking about you guys spend thinking about the patients that you treat. You're thinking about these guys and trying to get them back in the door. You're missing them like they're missing you. And there's no better time than now to reinforce that relationship and to strengthen it. The folks that value that, the patients and parents who see the value in having you at the other end of the telephone line, or having 20 minutes of your eyeballs on their photos rather, and their messages, there's no, you can't overstate the value of that. The reassurance they get for that. The folks that are complaining about being billed for it, hopefully can be compelled to understand what goes into it and why this choice is now being made. I'm disappointed by the reason for it, but excited by the turn, the change.
It's the silver lining for sure. It again, that crazy week of March 16th suddenly shone a light on telemedicine, something that many of us had kind of on the back burner and knew we needed to address, but now we have to address it. And it was stressful, but really good for everyone too, because now they're aware of how many interactions are in fact telemedicine. And you wouldn't walk into a grocery store or a restaurant and ask for a snack, a service, or an item, and then say, I didn't think I had to pay for this, honestly. Mm-hmm. Bonnie at B brought up a question about just working through the kinks of some custom patient portal messaging templates and how that fits into a vaccine workflow. Bonnie, I would highly recommend calling into support. You could speak with your client advocate or any of the rapid response team members to test things out. I have worked closely with some of my clients down south, similar approach, but for camp or school forms, where the template prompts with the questions, like say, in Connecticut, there are multiple pages to the school form, and there are portions that the parents have to fill out. And it's usually this very lengthy process, including multiple visits and faxes and printouts and all that. If you make a message template that prompts every single question that they need to answer and make the answer required, you can get all that information ahead of time and copy and paste it into your form version, which the physician then fills out, and make it all more streamlined and less paper and less clicks and less time. In terms of, let's see, there were a few other really good ones. Folks were looking for advice on disclaimer language. That's a tough one. Definitely a really good discussion for PCC community. I'm really proud at how much everyone has stepped up recently in that forum, seen some really valuable exchanges about specific state requirements, whether that's payers or legality around telemedicine consent, which place of service code to use, etc. I'm certain that if you all started a thread about what are your ideas on the best way to word a disclaimer, you'd see some really fantastic examples, real life examples. So a big plug for PCC community as well. I meant to touch on this earlier, but now that we're having this discussion, this has been a crazy time for everyone. And I just wanted to thank all the pediatricians and their practice members for all the hard work they've been doing. I know this has been insane. It's been crazy for all of us in our own ways. But on those hard days, for me personally, knowing that when I sit down and work, I am helping folks support communities and keep children safe and keep families calm, keep them supported, help mitigate the risks of COVID-19, help people stay at home, and keeping kids on their vaccine schedules. It means the world to me. It's very fulfilling. So thank you for what you do.
Yeah, and your point about keeping people on vaccine schedules, the folks that are looking for support to bring patients in for well care when patients are reluctant, when parents are more to the point are reluctant, that there are quite a number of news articles recently that are featuring and highlighting the risks, the increased risks or the additional risks of vaccine preventable diseases right now, being insult to illness. If COVID is the reason that a lot of children go unvaccinated and fall off their schedule.
Right, and get measles.
Right.
Like,
New York Times,
but we got measles.
New York Times, Wall Street Journal, it's been picked up, and many of your colleagues are reaching out to their local news stations to help them spread the word that the unintended consequence can be avoided, that you guys are working hard to make it safe for them to return. The idea that you're putting safety measures in place and detailing for folks the plans that you have created to maintain their safety in the event that they do have to have a face-to-face service, even if you can conduct the visit by portal or by telephone, even because some of those restrictions have been relaxed. That when you put it out there that these are the steps we're taking, that offers a lot of reassurance and can get folks thinking about responding when you do mount that recall effort. Kate, can you answer? There's a question that came through the last session. Yeah. Can you tell me if there is a resource? Someone's looking for a spot where they might see some examples of portal protocols and portal templates.
We do have protocol libraries. So I actually just marked that down as a big open square actionable item on this piece of paper that we, as we move forward with some other new tools as well, coming soon in the EHR, the need for libraries and examples and templates and best practices available to you all is more important than ever. So I will push that up the chain internally. We should absolutely have exemplary patient portal message templates available.
And there may be one or two, if my memory serves. I don't trust my memory. I was going to defer to you. The protocols.pcc.com is a place where one or more may be available. With you'd know better than I do if we've got the portal examples there.
With the new message templates in particular, we launch it with 3 or 4 default ones to kind of build upon, but I understand it can be daunting to create your own. And again, that's what the support team is here for. That's what your client advocate is here for. That's what rapid response is for. You call in and say, I'm trying to create a message template for X. Like, what is the goal here? And we'll help put the software pieces into place, because taking care of people is your job, and us figuring out how the software does it is our job. So we're very happy to help. We're very happy to help. And some things coming down the pipeline. Can I mention SnapTech? Kip already did it because he's so excited.
He let that cat out of the bag.
Okay, he did. All right. So text expansion integrated into the EHR is very close on the horizon. And what excites me very much is that it allows for multi-line functionality, full paragraphs, folks. So if you come up with a practice default for frequently asked questions and responses in the portal, you could use a snap text like .portal1, enter, and an entire letter spits out. So if there's something you are frequently finding you have to respond to via the patient portal, you would create a practice-wide or a custom user snap text, as we're calling it, a text expander. So that can also help streamline this process of getting used to messaging folks directly. Let's see.
Yeah, there's a couple of really good suggestions, if you don't mind me sharing from chat. One practice cautioned that if you are going to reach out via text, which I think was part of the discussion, be sure to identify your practice in the text, because it's being received from what they might otherwise not recognize, a number they might not otherwise recognize.
The area code they don't recognize.
It doesn't necessarily match anything that they would be expecting if you're reaching out. Be sure to put your practice name in there. It seems like an obvious thing, but that's one of those things you learn by experience. So thanks for that suggestion.
Yes.
And as far as folks that there are a couple of folks on chat looking for reassurance about reaching out to patients too much, worrying that they're being overbearing or pestering patients. There was a great response in the chat related to varying your message. So it's not a matter of constantly sending out the same text or hammering the same message. It's a matter of being visible and there have been some great marketing discussions in the PMI Thursday night webinars that Chip has done with Paulie Ventieri these last, my gosh, it's got to be up to 7 weeks now, where marketing is one of the messages, where you use social media, you use text, you use email, a variety of messages in a variety of formats can keep people engaged without it being COVID. So for what that's worth, if there are messages, if you just want to remind people about, typically it's things that your clinicians are passionate about. If you've got a little blurb or a blip that they can share, hey, I learned this today, or don't forget we recommend X, Y, or Z. It can be a variety of messaging that keeps it fresh and still keeps you at the top of their mind and reminds them that you're somebody that can help.
Right, and I started jotting down some bullet points of different broadcast messages to keep mixing things up. Important to note that you can really drill down on the population of your patients' families that you are reaching out to. So it's not everyone all the time. So you can really drill down and say, this is a well-recall broadcast messaging only for toddler age, and make the text more relatable in that way. This is a vaccine recall only for measles, and make it very specific and more meaningful. I think you would pester someone perhaps if it seemed really generic or the message was repetitive. But what if you, up on your website or Facebook, put up a great photo album of things your families and your community have been doing to keep kids engaged while staying at home. And you just send out a friendly reminder, because broadcast messaging and the patient portal has hyperlink capabilities now. Test your hyperlinks first. You can send out links to these things. And I would love to get that message from my primary care. Bored at home, check out these great ideas from our community. Or maybe you have postpartum depression accounts flagged and you reach out to all those folks at once. That would probably mean the world to them, saying we're available, or just a general happy Friday reminder of our new hours. it doesn't have to be all policies and procedures. It doesn't have to be scary doom and gloom. We're going to bill you more. It doesn't have to be COVID-19 related. But yeah, like it's been an interesting era of realizing how much you have to now market and advertise yourself, because with folks not going outside, so many businesses, pediatricians included, have disappeared off, the realm of their forefront of their mind. Like you're no longer visible to them. Everyone is so consumed with what they're doing, stuck at home. So you want to keep reminding them that you exist, that you're safe, what your hours are, what you're offering, especially kids with well visits coming up. However you are making well visits available to children, it is so important to hammer that message home. And
this is such an opportunity.
Yes,
I know I sound like a
I don't
total
think you
poet.
can say that too much. I would like constant reminders that I have a well visit coming up, because somehow that day always sneaks up on me and I'm like, oh shoot.
Yeah, I feel like such a Pollyanna when I say things like this really is an opportunity. The ways that you can transform your practice processes just keep mounting every time I have another conversation. There's one practice recently that was very reluctant to initiate a credit card on file policy. This was the impetus. This made it necessary for them to gather the information, but going forward, it's not going to seem strange at all to their patients for them to ask, to say our policy now is, and you want to refresh that and give patients any opportunity they would have had if you were to initiate the policy without the quarantine conditions in place. But this is their opportunity. They can say, here's how we're going to do this going forward. For super high deductible health plans, we're going to keep that card on file and we'll send you one bill or no bills, pay within 30 days. You've got balances due on the portal. So portal plug number 40, you can take payments right from there. So they've got control but you've also got reassurance. Another opportunity that was taken was to get staff excited about it. You Kate, had made the point earlier that, incentivize it if you can. Get people making patients excited about it. The conveniences, until you get it going, it's difficult to describe, or it's not as effective to describe the convenience. But once they see it, boy, if they don't take full advantage of it, I'd be really, really surprised. Parents being younger and younger all the time relative to me, the younger folks are, the more likely it is that they're comfortable electronically and their expectation is online.
Expecting it. If they reached roadblocks where they realized you don't have a portal, that could be frustrating for them. If they log into the portal and they can't pay their bill, that's frustrating for them. So keep in mind the millennial mommies for sure.
Yeah. And if you're unconvinced, ask them. What better time to engage them that way? Say, you know what? We've got time to think about this. How do you want to engage with us? Where do you want to see us? And take advantage of the time that they probably have. Like you said, 3 a.m. They might be very happy to respond to a survey while they're breastfeeding.
And tying this back into telemedicine, with the last COVID release, the 8/12/12 release, you now have the ability, once you schedule a telemedicine visit, to indicate the patient login links to whichever platform you've chosen. So that could be Zoom, that could be WebEx, it could be Doxy.me, Anytime Pediatrics, you name it, whatever you're using. If they have a portal user, that's automatically pushed to the portal. If they don't, there's like a red warning right in the chart. So as the physician or whomever is performing a telemedicine visit sees that red warning, that's just another reminder to bring up the portal during that audiovisual or phone call telemedicine visit and say, hi, I just noticed we do not have your email or cell phone number on file to be able to communicate with you via the portal. Did you know you can pay your bill and get your growth charts and your immunization right, et cetera, and gather that information. So awesome. It all ties together.
Indeed. So there continue to be great suggestions in the live session. I hope folks will continue that even between sessions as we go. Kate, do you have any ideas to wrap up with, or anything further that we haven't already shared?
No, just another shameless plug that support is here.
Indeed. I love getting that perspective.
Yes. So on this last question slide from my slide deck, I put the email for support, the number for support, and the login for our portal, so to speak. If we're the doctors, you're our patients. And if you want to log in and look at all your recent appointments and your issues and your problem list, that is the support portal. So
Awesome.
yeah, just another tool to be in touch with us and keep a finger on the pulse of any issues that we're resolving or requests you have made.
Good, good. Thank you so much for doing this, Kate. You put a lot of great stuff in one place. And now that I shared the slides a little bit after we began, so I hope folks had a little bit of patience with me on that. I appreciate it. And the next session that is available to you guys will be at 3 p.m. today. Chip Hart will be speaking about practice culture, which, did I mention opportunities? This is a good time to review and set some goals for your practice culture, and Chip will discuss and describe how to do all that. So thanks again, Kate. Thank you, everybody,
Thank you all for attending and for your wonderful ideas. Keep them coming.
Indeed. Thank you. Thank you. Bye, everyone.